a 26 years old, had delivered her first child on 8 November 2020 at 9 a.m. She complained of mild pain on her abdominal region with the verbalization of pain score 2 out of 10. The doctor has prescribed paracetamol PRN if she feels the pain is elevated and ordered to off CBD and vulva swabbing.
The rationale to perform vulva swabbing for postnatal mother firstly is to prevent ascending infection up to the genital tract, and then the second one is to keep the patient clean and comfortable.
Now, what are the equipments needed for vulva swabbing? Firstly, we need a trolley. This is the type of trolley usually used for vulva swabbing in maternity 3 SGH. Now, we arrange the equipments properly by dividing into top trolley and bottom shelf. For the top trolley, we will need 1 pericare set, which contains a bowl, swabs, and 1 sterile pad. After opening the pericare set, we need to prepare 1 basic pack, 1 pad obtained from the patient, and 1 sterile glove. It is important to remove the sterile pad from the bowl without touching it with bare hands before pouring the chlorhexidine 1 to 2000 into the bowl. Next, we move to the bottom shelf, a bedpan which will be covered using a large clinical waste bag. Next is lotion chlorhexidine 1 in 2000. But in the ward, we used sterile water as alternative since chlorhexidine has expired. A disposable glove to remove the patient's soaked pads and sarong. Last but not least, ribbon gauze if the patient's pad string has been soiled.
Next is procedure for vulva swabbing. Before we do the vulva swabbing to postnatal mother, we have to prepare the equipment, then inform the mother and screen the mother to provide privacy. Next, we have to place the plastic Macintosh to protect the bed. Then, loosen the sarong and untie the pad string. Next, place the bedpan under the mother's buttock and remove the pad from front to back. Before doing vulva swabbing, remove the indwelling catheter by putting 10 cc syringe at the catheter balloon and withdraw the water out. Once the balloon is empty, gently pull the catheter out. Then, observe the lochia for amount, color, consistence. Palpate and note the involution of uterus. Remove disposable gloves and hand rub. Open the sterile pericare set, pour the lotion chlorhexidine 1-2000 into the bowl, do surgical hand wash and put on sterile gloves. Hold the bowl with lotion, swab on right hand and then pour lotion over vulva. Perform vulva swabbing. Swab the labia major from far to near, from top to bottom, each swab used once only. Then, part the labia minor with thumb and index fingers. Steps same as labia minor. Lastly, swab the vestibule from top to bottom, then place the sterile pad from top to bottom portion of the vulva. Then, secure the sterile pad with pad string. Instruct mother to lift up the buttock to remove bedpan. Remove all the plastic Macintosh, clinical waste bag and on glove. Document the color and amount of lochia on the chart.